Okay, so I recently I did a quick talk. It was brief, about 10 minutes, and then did a. It was like almost like a meet and greet. One of our patients is a commissioner at the local sanitation department, and he's been coming in getting really good results. He likes what we do, and he knows that we offer workshops. So we've done a lot of schools, churches, corporate. We host workshops in the office. We've done a ton of different like hobby groups, all different types of things since 2001. So he knew we did it, but he said, listen, here's the situation now. He goes, you got to be there at 5:30 in the morning. So that was definitely the earliest one. I said 5:30 a.m. So we did it. So I went there with our two massage therapists, and we met a bunch of the guys, really nice. And one thing I said to them, I go, listen, you are a blue collar worker. I said, I'm a blue collar doctor. I have a physical job, not anywhere near as physical as you. I said, but I hurt my back when I was 21, bad, went to the hospital, got an injection, a local. I was in college, and that led me into this. But I told them, I explained to them, I go, look, you should ask yourself, what's your quality of life going to look like in a year or 5 years from now? Most of us don't think like that. And then they told me, they go, look, we can't collect our pension until we're 55. Doesn't matter our age, how many years, the combination. Sometimes it's a combination of your age and how many years that you worked. They said, no, it's 55 no matter what. So a lot of guys, a lot of people continue to choose to continue to work as long as they can, as long as they can do it physically, right? Unless something happens and they can't do it anymore. And that's the issue, because they get a lot of injuries, back pain, neck pain, headaches, carpal tunnel, sciatica. Now, what I also want to point out to you is that, a lot of times people watch, our videos, or they'll take our information, and, they'll come in, and it's kind of like, they'll tell me, well, I didn't have a car accident. I don't work a physical job. I just sit at a desk all day. And I tell them, that's worse. It's even worse. You're sitting at a desk all day. Your whole spine's just compressed in a forward posture. It's horrible. So what happens is your spine gets all locked up and stuck, and those joints, those bones don't move properly. It puts torque into the spine, torque into the disc. And the way that the disc works is when the spine pumps. It's called imbibition. It means pumping in the spine. That doesn't happen if your spine is stuck or if it's subluxated. When that's going on in your spine, that's what leads to the disc degeneration. Ultimately, it can lead to bulging and herniated discs. And then because the disc is damaged, the body compensates a lot of times, and it will lay down bone. That's where the bone spurs come in. And then the scar tissue, the adhesions, the fibrosis, the chronic inflammation around that joint. So we see this all the time. And a lot of times I'll show people their x-rays, and they either have never seen x-rays of their spine, or they've never had them, no one ever went over them together. Like, they never showed them the x-rays. They might have heard about an MRI report they had. Sometimes people will be like, yeah, I was told I had a disc injury. That was like 10 years ago, though. I go, yeah, but that doesn't just like go away. So if you left that damage, of course, if you leave the spine stuck like that over time, what's that going to do to your spine? It's going to break it down. And your spine houses your spinal cord. And this is what I explained to them on, like last week when we did this mini talk at their sanitation department. I asked them to think about what's their quality of life going to look like. I told them that they have a really physical job, and I explained to them, I said, front to back, your spine should be straight, but from the side, you don't want straight. You want curves for shock absorption. Those bones are stacked up on top of each other. There's discs in between. They're movable. The main generator, I said, this is the electrical system, is the nervous system. I said the main generator in your body that controls everything in your body, generates all the power and the information, is your brain. An extension of your brain is that spinal cord, and then you have these wires, these nerves coming out from between those bones, and that needs to go to every organ in your body, every cell, tissue, and organ. So for everything to work properly, wouldn't you want 100% connection? Well, if your spine that's protecting that starts to break down, do you think that could affect that? And they said, yeah, that's common sense. And then a lot of them came over to the table that we were set up at, and they said, listen, I have damage. I got to do 5 more years. I got to do 10 more years. Yeah, I hurt my neck. I have the numbness and tingling going into my fingers. I've had sciatica in the past. Sometimes it bothers me. Right now it's okay. My hip hurts. Do you think that's because my pelvis is off? And I said, listen, the best thing to do is get checked out. But, I told him also, I said, listen, I've been, doing this since 2001. And I said that, I'm always thinking, okay, how am I going to be, what's the game plan for like the next 5 years when it comes to my health? All right, well, I need to make sure I get these things happening. And I said, a lot of people don't plan with their health. They don't plan. They just kind of live crisis to crisis because that's the way we were brought up, myself included. And I told them, I said, listen, the best thing to start with is an examination. Have a consult and an exam. And a patient heard me talking to another patient yesterday, and they go, I've been trying to get my husband in here, and he won't listen to me. And, I know you do these workshops, and, I heard about that, health screening you just did with Sanitation department, and, he has damage. I said, listen, you're trying to tell him he needs to get adjusted. What I said to do is say, listen, first of all, it doesn't have to do anything. Sometimes your family is the hardest. Like if you're doing something, they might not want to do it. What are you going to do? You can't force anybody. But what I did say, I said to him, to her, I said, listen, say to him, the doc said, would you ever consider getting your spine checked? Would you ever consider coming in for a consultation? Would you ever consider getting digital motion x-rays, non-invasive, super cutting edge, because we stand you up against gravity, and then we can see structurally what's going on, but from a functional standpoint, we put you in different positions, and you hold the positions, and we can see if any of the bones, the joints are stuck. And if this pressure is happening in your spine, this subluxation is happening, which, by the way, every time that does happen, whether you feel it or not, that sends stress signals to your brain, causes a release in stress hormones, and it puts you into fight or flight stress. Now, what we do in our office is we find those areas, we lay you face down on the table, and we make gentle adjustments, and that sends positive signals to your brain, and it taps into what's called the cerebellum and the vagus nerve to get you out of stress. So there's a little neurology tied in with there. But these are some of the concepts I explained to the guys that I was talking to, and even to our patients. And when you put it like this, it's like, it just makes common sense. So I would say this, even if you have a desk job and you don't have a physical job, that might be worse because that increases your chances of diabetes, heart. It's just bad, right? Physical issues, right? Sitting all day, it's not good. So you should definitely get checked out, is my point. And then also ask yourself, what's my quality of life going to look like in a year or 5 years from now? What about when it's time for me to, start to maybe transition and maybe work part-time or move into like a retirement? What's my quality of life going to be like then? Am I going to be able to travel, take care of the grandkids? Am I going to be able to, go to the beach? Am I going to be able to volunteer? Whatever it is you want to do, you should start to ask yourself, what are you doing now to prepare for that? Okay, because the worst thing is to work really hard and to grind and then get to this time in the future when you're supposed to enjoy life, and then you just spend every day miserable or in different doctor's offices or just trying to, get your health back. All right. So I hope this message finds you well, and I'll talk to you soon.